Thank you very much for the introduction. My name is Eleni and I work in the area of nutrition and dietetics. And thank you very much for giving me the opportunity to present today some of the findings of my PhD project, which I completed last year in Queen's University in Belfast. And as I said, my area is nutrition and nutrition in the early years of life. And in particular on parental attitudes and practices during complementary feeding. For those of you that are not familiar with the term, complementary feeding is a period that starts with the introduction of solid foods in an infant's diet and continues up to the age of 2. And it holds great importance in future development and health, and its importance is gaining increasing interest, especially in the last 2 decades. A safe and effective transition to a mixed diet with complementary foods aims to meet the increasing nutritional requirements and replenish infant stores in iron and zinc for optimal growth. But also it provides exposure to new tastes and textures that will set the foundation for future healthy dietary habits. Within my project, I aim to gain a better understanding of the factors that influence parents' feeding behaviors, especially those behaviors that clash with the complementary feeding recommendations and lead to obesogenic behaviors. So my first objective was to look at the available qualitative evidence and to provide a synthesis of parental perspectives and considerations during the complementary feeding period. I conducted a systematic review of studies published after 2001 with parents living in higher income countries and with a child younger than the age of 3. So current evidence reveal that there's mixed attitudes towards the recommendation on introducing solid foods in 6 months. There was a prevalent belief that the recommendations reflect a one-size-fits-all, approach which is not relevant to individual infants. Additionally, infant hunger was a strong cue to introduce solid foods for the parents and often led to early introduction of solid foods earlier than 4 months. Additionally, there was an increased trust on grandmother's feeding advice, which was often considered outdated and contradictory to complementary feeding recommendations. And there was confusion around the appropriate timing of introducing certain foods, in particularly those associated with food allergies. And then I embarked to collect some primary data and to explore parental experiences during complementary feeding, and in particular, experiences of the factors that can favor establishing healthy eating habits. So for that, I conducted a series of focus groups with mothers, whereby I gauged their perceptions around taste preferences and how these are acquired in infancy, and also the importance of dietary variety. Our findings reveal that mothers saw their role in encouraging positive eating behaviors crucial, and they did so by offering a repeated exposure to healthy foods, modeling healthy dietary habits, and forming a positive atmosphere around feeding. They also considered variety during infancy, food variety during infancy, as a way to prevent fussy behaviors in the future. But although food variety was recognized as important, there was a limited understanding of the meaning of food variety, and findings can be seen in our publication in Nutrients. I thought the finding around food variety and limited understanding of it was very important. So then that led me to my late where I aimed to assess dietary quality and diversity during the complementary feeding period, and to test its association with certain parental and infant characteristics. Through an online questionnaire, I collected cross-sectional data on complementary feeding practices of a sample of parents living in the UK with a child in complementary feeding age. Based on our findings, first I should say that dietary quality was assessed by using the Complementary Feeding Utility Index, which is a multi-component tool that was developed using data from a large UK cohort, which tested the degree of adherence to complementary feeding guidelines. So our findings reveal that higher dietary quality in infancy was associated with mother self-efficacy in providing healthier foods and restricted unhealthy snacks. It was also associated by mother's reliance on the complementary feeding guidelines offered by the NHS, which is the national guidelines for the UK population. So to conclude and to close this presentation, I believe that acquiring a thorough view of parental feeding behaviors requires utilizing multiple and diverse methodologies, including qualitative and quantitative techniques. Based on our findings, we believe that focusing on enhancing maternal feeding self-efficacy holds benefits in shaping their feeding practices and improving those. Healthcare professionals, which are tasked with the delivery of infant feeding education, need to tackle the reasons for introducing solids early and for excluding recommended complementary foods from infants' diet. Additionally, they need to address, as part of their education, critical thinking towards advice, feeding advice, which is not evidence-based. And last but not least, father's role in research has been underrepresented. And we believe that future studies need to further explore their role and their contribution to shaping children's eating habits. So with that, I would like to finish my presentation, and I'm happy to get any answers or share any of my references through email or Twitter. Thank you.